Does anyone know why 20% of all people at some point in their life will see their healthcare provider? The answer is your rotator cuff. What is your rotator cuff? It's a group of muscles and tendons in your shoulder that form a cuff over the top end of your arm. It's the most important part of your shoulder because it helps your arm lift and
Excuse
rotate.
me, is that yours?
Yes.
Oh, okay.
Yeah, I just put it up.
Okay.
And it also keeps your humerus in your shoulder socket. So not only does it protect your shoulder, but it allows you to move your arm over your head, and it keeps your shoulder steady as your arm moves. It's not only important in our activities of daily living, but it's especially important if you play sports like baseball, swimming, or tennis. It's a complicated process that your body makes look easy. So here's a picture of like the rotator cuff. The main muscle that lets you rotate and extend your shoulder is called the infraspinatus. The muscle that helps you lift your arm and rotate your shoulder is called the supraspinatus. It's important because it holds your humerus into place and it keeps your upper arm stable. The smallest rotator cuff muscle is the teres minor. Its main job is to assist with the rotation of your arm away from your body. And the subscapularis holds your upper arm bone into your shoulder blade. It helps your arm rotate, hold straight out, and lower. A rotator cuff injury may happen suddenly when falling on an outstretched hand. That's when you'd receive like a tear, similar in this picture right here. It all may also develop over time due to repetitive activities. Overuse would injure this muscle here. So tears also happen due to aging and degeneration of tissues. And so soreness from wear and tear happens mostly to people over the age of 40. And so you're likely to have this if you move your arm a certain way over and over for like a job, if you're like a painter or a carpenter, or if you play sports like tennis or baseball. If you repeat the same activity over and over and do the same thing again and again, the rotator cuff can start to wear like a worn sock, and it can separate or tear simply by attempting to lift something heavy. So you can't always feel a rotator cuff tear. In some cases, you might have trouble raising your arm. The pain can be described as a dull, deep ache in your shoulder. If you have rotator cuff tendonitis, the pain would be in the outer part of your upper arm as well as the front top of your shoulder. And it could worsen when you raise your hand above your head or reach behind you. It can also wake you up at night and disturb your sleep, particularly if you lie in the affected area. It can make it difficult to comb your hair or reach behind your back, and it can all be accompanied by weakness in the arm or loss of strength. If you have weakness in your muscles, it could also be a number of different problems, like not only rotator cuff tear, but also impingement, shoulder or bicep tendonitis, or shoulder bursitis. And so that would be something like similar to this, like where there's a sac filled with bursa that fills with fluid. And so any of these problems can cause a loss of range of motion and limit your function of all your upper extremities. So it may like resemble other conditions, so it's important to always talk with your healthcare provider for a proper diagnosis, especially if you're not able to use your shoulder like you normally do, or like lift heavy things like normal. If it begins to worsen, you may experience recurring pain, swelling, or tenderness in the front of your shoulder, or hear a clicking sound or grating sound or cracking when you raise your arm above your head. If you don't do anything about your rotator cuff symptoms, it can become more serious over time. You can end up with frozen shoulder, a pinched nerve, or arthritis, which are all harder to treat. And so if you have any of these signs, see a doctor to find out for sure. If you have a torn rotator cuff, the doctor will likely start with a history of your injury. They'll ask you several questions like, where's the pain located? How severe is the pain? What movements or activities aggravate or worsen the pain? He'll find out if there's weakness or numbness in your arm, and when you first experienced that shoulder pain, and if you've ever injured that shoulder before. He'll ask you about your symptoms and if it travels down behind your arm or below your elbow, and the shoulder pain could also be associated with any neck pain. And then he'll find out if you have any hobbies or a job that aggravate the pain. And so you should be prepared on your first visit to answer questions like these to get the most proper diagnosis. The doctor will then take a look at your shoulder. Physical examination will test your arm strength and ask you to move your arms in a different way. That way you can determine your range of motion. And he'll press on different parts of your shoulder and move your arm into different positions to see what movements make your shoulder hurt. He'll test the strength, and he may also order an MRI that takes like a detailed picture of your shoulder using like radio waves and magnets, and that lets the doctor see any swelling or tearing of their tendons. They may also use an X-ray, although like X-rays won't show actual tear. They'll show like whether the humeral head, the top part of your bone, is pushing into your rotator cuff space. But you can also visualize bone spurs and arthritis on an X-ray, so that's why it's helpful. Or they could also use an ultrasound test, which uses sound waves to produce the image of inside your body, and that helps them see the tendons, the muscles, and the bursa in your shoulder. And this type of testing allows for assessment like while your shoulder's moving, and so it gives a quick comparison between a healthy and an affected shoulder. Conservative home care treatments are usually the first place that they start, and that like involves rest, ice, and physical therapy. That treats many of these problems, and that's all that's needed to recover for most of these injuries. But if it's a more severe injury, or a complete muscle tear or tendon, then you might need surgery. Physical therapy is usually the first treatment. So there'll be a combination of exercises that are tailored to make your shoulder muscles stronger and to increase your flexibility. That'd be the main focus. This could also be accompanied with over-the-counter and anti-inflammatory pain medications. That would be like acetaminophen, aspirin, ibuprofen, or naproxen, and those help with pain and swelling. So if the conservative treatment doesn't reduce your pain, the doctor may also recommend a steroid injection into your shoulder, and that's if the pain's interfering with your ADLs or your sleep or your exercise. So these shots are only temporarily helpful. They should be used sparingly because they can contribute to weakening the tendon. If the doctor thinks you have a tear, he may send you to someone who treats bones, joints, and muscles and tendons, and that's the orthopedic doctor. They'll talk to you about surgical and non-surgical options, and that includes physical therapy. And so that's usually the starting point. You'll get exercises to do at home and suggestions on how to use your shoulder in a safer, more comfortable way in your daily life. So the physical therapist then usually asks questions about your life and the things that you do, and he'll learn more about your pain to see what your limits are, and he'll attempt to get you back your range of motion and help you learn exercises to strengthen your shoulder muscles and to improve your posture and to help reduce your pain. They also can help you find ways to sleep that doesn't hurt, and they'll teach you how to carry objects safely, and they'll show you how to use heat and ice to ease their pain. They're helpful in finding ways to do things like not to hurt or re-injure your shoulder, and their main goal is to, of course, help you return to your regular activities. So most people who follow these steps improve within 3 to 6 months. If you're not getting any relief with these steps and the symptoms don't go away after 6 months, the next option is surgery may be the next option to relieve your pain and restore the function to your shoulder. If you have a tear and the tendon can't heal, then you'll likely need to stitch like the torn or reattached tendon to their bone. In some cases, they need to take a small piece of tendon or bone that's stuck in their shoulder, and that gives it more room in your arm. So that's called the rotator cuff impingement surgery, and that's helpful in relieving pressure on the tendon. And the surgeon may also grind down the spur in this bone, so like for anything that's overgrown, any bony growths, they'll grind down and smooth the bone, and then they'll clean and fray the portion of the tendon by shaping them. This surgery is often done like by arthroscopic scope and on an outpatient basis, so it means you shouldn't have to stay the night in the hospital. An arthroscopic repair is when the doctor makes a small cut into your shoulder, and he uses a tube with a small tiny camera and tiny instruments to fix the tear. So this means your recovery time will likely be shorter than it would with any other type of surgery. Other procedures, you may need to stay in the hospital overnight. Open tendon repair is the surgery that's been around the longest. It's the first technique used to repair rotator cuffs. If you have a large tear or it's very complex, the surgeon may choose this method. A large incision is made into your shoulder and a muscle is detached so the surgeon can have complete access to your tendon. Lost the card here. I lost it. So this is helpful also too. And after surgery, like they usually recover if they give you exercises like day to day, and they help you relearn movements and use your shoulder to regain strength and range of motion. So many people take their shoulder for granted, but it can help you do a lot of important things. It can help you play tennis or baseball or game and catch, comb your hair, grab something high off the shelf. So not only using or relying on your shoulder, it's important to understand what types of treatment make you feel better and how to keep a small injury from getting worse. So if you have a rotator cuff tear, you're not alone. It happens to millions of people every year, and it's a common cause of shoulder pain. So I hope I uncovered some ways you can help your injury heal. Oh yeah, is there any questions?
So the most popular surgery will be endoscopy?
Yeah, that's the most common one.
Because it's outpatient, right?
Yeah, that's the one they usually start with because the injury time's shorter. But if it's like a complex tear, if it's like frayed or worn in several spots, or if it's completely torn, they need direct access, then they'll do a full surgery.
So if not really treated on time, you can really have a frozen shoulder and your ADL.
Yeah, it can lead to arthritis too, which is like harder to heal, or like shoulder impingement, like it bursa sac in your shoulder fills with fluid, and that's called impingement, so it leaves no space for your arm to move.
I had a friend that worked here.
Oh, I didn't tell you about my pictures. Can I tell them about
Yeah,
my pictures?
yeah.
I put a picture of Ben Roethlisberger, the quarterback for the Pittsburgh Steelers, and Kobe Bryant, NBA Laker player, because they both had torn rotator cuffs. Kobe had to sit out for almost a full season because he had surgery and recovered from it. Ben Roethlisberger played through an entire season with a torn rotator cuff. And then also, not so fun fact, they were both accused of rape, but settled out of court for undisclosed amounts. So no one knows if they're childhood sports heroes or rapists.
So I have a question. Daniel, I have a question.
Yes.
So after the surgery of Kobe, did he continue to play?
Yeah,
Okay.
after the rape charges too.
Yeah, but actually, that's good. I'll answer. Put it over there with the rest of them. Actually, those charges for the drop, but she never did really go to court. They said, I'll read some about that, but, you have to be very careful. And, I think they just had something on, I was reading about that. Some of these women, they just so flirtatious. I always say it's two sides to every story.
That's true.
I'll always say that because,
Especially when there's millions on the line.
Yeah, when you're high profile.
They throw themselves.
but not only that, and then I'll be quiet and go on, not only that,